The RSPCA is an animal welfare organisation that works towards rehoming animals that have either been abused or abandoned. We have approximately 280 staff. We have a very large volunteering base. My role as the injury management coordinator is obviously the rehabilitation of our injured workers and volunteers. However, I have taken on probably a more preventative role now. When I started at the RSPCA, our workplace health and safety was a reactive system. 90% of what we did was reactive, 10% of that was transactional. So we have very high work cover premiums. We had no safety culture. Managers weren't aware of their own responsibilities. So what we set about doing was actually introducing risk management to our staff and volunteers. We organised training for every single staff member on site, starting with our senior leadership team. We involved WorkSafe Queensland. An advisor came out to help us and explained everyone's responsibilities in terms of the new legislation. We then designed a program that I presented throughout the state and at Wacol to all of our staff members. The idea being that if our staff members could put in place the risk management program, they would then be able to successfully teach our volunteers how to do that. Our staff members, they didn't want something complicated or difficult. So through consultation with them, we realised that the best thing to do would be having a standardised program that was available to everyone throughout the state, which is why our hazard identification is now online. The hazard identification form is also designed to facilitate that consultation. So when people report those hazards, we also ask them to put forward their preferred control measures. We also introduced online inductions. We found that a lot of people, when they started, they didn't understand the RSPCA's way of working in health and safety, and there was no culture. So using an online induction, once again, we've provided that standardised system of training to everyone. We've had an overwhelming success rate. The majority of our hazards have been controlled in some way. We've performed an audit on our hazard identification program and our risk register, and that just shows that not only are people reporting those hazards and controlling them, but they're actually actively thinking about ways to improve those control measures.